Dr. Kaufman here, testing sound. Logan, please let me know if that's okay. Testing sound. Logan, let me know if this is okay. The white cat sitting on the yellow chair is the dude, and the dude abides. He's a Siberian. Very interesting, very smart cat. This is Dr. Jamie Kaufman. This is my reflux hour. And today I want to talk about natural remedies. Everyone wants natural remedies and avoid doctors and avoid medicines if possible. I've chosen to divide this into the good, the bad, and the ugly. Good meaning probably helps. Bad meanings probably snake oil. And the ugly means actually it's going to make your reflux worse. I'm going to try to do 15 minutes and then answer questions. And there is some overlap between the questions today and what I'm going to present first. If your lifestyle basics are terrible, I mean, if you're eating before bed, if you have a bad diet, if you consume lots of soft drinks, nicotine, alcohol, then worrying about some adjunctive treatment is a little bit like getting a bucket to bail as the Titanic is sinking. The bailing's not going to make any difference. These small differences are add-ons for people who are moving very much in a successful direction. So I want to talk about the goods first. Um, my most recent blog that was just put up yesterday is on alginates. And alginates are a product that comes from seaweed. And actually, it's in everything. For example, some frozen onion rings and some fast food onion rings are actually ground up onion and alginates, and then they're formed into rings and so on. There are alginates in medicines, there are alginates for wound care, there are alginates in dentistry. But the alginates in medicine have been around for a long time. And the one that's been around for a long time is Gaviscon. And while there's Gaviscon in your pharmacy, it's a 1950s version that's mostly um, an antacid with very little alginate. Now, what alginates do, once you swallow the alginate, what it does is it coalesces and forms a raft of gel that floats up to the top of the stomach and helps block up the lower esophageal sphincter. The alginates are completely benign. The only problem potentially is there is a fair amount of sodium, and so if you're on a salt-restricted diet, alginates may not be for you. Alginates are particularly important for people who have not nighttime reflux, which is most of you. And when you have a swig out of the bottle, I usually recommend 2 teaspoons, and it's consumed after dinner and before bed. If you're having heartburn or rebound hyperacidity following PPI cessation, you can take it after every meal. There is a new product called Reflux Gourmet, and the irony is one of my fellows and a dear friend at Harvard came up with this product, which I really don't know how to evaluate. We've done research on Gaviscon, and people who take Gaviscon get better and get better faster. And so we know it's helpful. We never published the paper because the head of Reckitt Benckiser left the company and he was responsible. But it works. It's a tough question for me to say, which do you prefer, Gaviscon Advance or Reflux Gourmet? They're both available online, but the deal breaker for me is the Gaviscon Advance is 70% more expensive. So I recommend, and what I tell my people to order is Gaviscon Advance. That's the name of the product. Aniseed, 500 ml bottles. You usually can end up on Amazon, although occasionally you'll find a place where you get cheaper. But the bottle should be a big bottle. It should have a white thing. It should have Gaviscon Advanced Aniseed. They make a peppermint, but we don't recommend the peppermint. At least I don't recommend the peppermint. Antacids are really only for people who have heartburn, which is not most of you. The big change, if there's a big change to be said, is that most of the nation, most people have silent nocturnal respiratory reflux, and most people don't have heartburn and indigestion in the GI heartburn business model. So respiratory reflux is the thing. Chronic cough, chronic throat clearing, too much mucus, dry itchy throat, trouble swallowing, a sensation of a lump in the throat, trouble breathing. It goes on and on and on. Respiratory reflux is huge because it can affect even sinuses and ears. So that's what most people have. So the alginates are very helpful. They're adjunctive treatment, and antacids not so much. But alkaline water I want to talk about because apparently there's some controversy about it. Let me begin by saying there are 0 side effects to alkaline water. Okay, I very often then I'll say 0. I'll say 99% or 90, but there is 0. There are millions of people who are drinking alkaline water, and alkaline water is very good because the problem child in reflux is pepsin. And when you reflux, up comes this enzyme pepsin and attaches itself, say, to your vocal cords or throat. And when you drink anything that's acidic, it activates the pepsin. But when you drink alkaline water actually kills pepsin. Pepsin dies at about pH 8, and alkaline water I'm recommending is 9.5. I use this Sierra water pitcher. It's not available online. I've had it for years and years. It's my second one. Don't put it in the dishwasher, it'll melt. And everybody knows my pink cups are going everywhere with me. So the second part of this turns out to be much bigger than I thought. The problem with alkaline water is when you swallow, it doesn't get in your lower throat at all. That part of your throat clamps shut, so you don't aspirate. But if you put your 9.5 alkaline water in a sprayer, I can spray my vocal cords, my throat, and if I'm having nasal problems, the same company, this is my last article on the blog on alkaline water. It's February 27th, I think. But you can get these 4 for $8, and they make a dropper. So when you get up in the morning, you can put that in. So alkaline water can be used as a drink, as a spray. And finally, it can be used as for pH balancing. For example, this is top of the line balsamic vinegar. That bottle may be $50 or so, and if you take care of it, I only buy a bottle every year or 2. The thing about it is, it only takes 4 drops, and then oil, and then 4 drops. So it takes very, very little. And so, although it's acidic, there's so little of it. So if you're drinking alkaline water with a balsamic vinegar in your salad, it's not the end of the world. And the whole concept of pH balancing goes further. I told you about making, if you read my article on breakfasts, there is use almond milk, use a banana, and use little frozen, you have to use these little tiny ones, and if you put these in, along with your pH 7 alkaline water and your banana, you can probably add whatever else you want to smoothies. I think smoothies are a great breakfast option. So alkaline water is good for reflux, good for the esophagus, good for the LES, good for spraying, and half the singers on Broadway carry these with them, these little bottles. And then finally, it's good for pH balancing. Chewing gum is a really fun kind of discovery. I don't know, it's got to be 30 years ago, some patient who had heartburn said, you don't want to chew gum, my heartburn gets better. So we actually studied it. And if you go to Carnegie Hall, you'll see that there are these containers where you can take Ricola cough drops. And the reason they're there is that people have gone out to dinner, they've had a cocktail, they're going to reflux, they're going to cough and clear the throat. So we give them Ricola when they suck on that, which is the same, sucking on a hard candy it's safe, meaning not mint, etc. And chewing gum, not mint, does a couple of things. It makes more saliva, more salivary bicarbonate, and you swallow a lot more. And we've studied it, and there's an article on alkaline water, on gum chewing, and you'll find that there's ability to absolutely abort a reflux episode. So I recommend a chewing gum after each meal or sucking on hard candy. A lot of people like Manuka honey, that's fine. And when you're exercising, take medicine before, take the alginate before, and then chew gum or suck on a hard candy while you work out. One of the questions that's coming up is reflux and exercise, and the answer is yes. And some exercises are worse than others. So I don't want to spend forever on this, but I do want to mention that ginger is time-honored. Ginger's been used for stomach problems, as has aloe vera, for centuries. If you're going to use the aloe vera, you buy a leaf, you open it, and you take out about a tablespoon or two of the inside, and you put it in with your smoothie. And it's good for you, and it also gives the smoothie a better texture. I do recommend probiotics. This has been a question for a long time, but I've now had enough data, if it is clinical data, that probiotics are fine. I can tell you I personally buy the least expensive Walgreens brand. Manuka honey, I've done an article called It's Manuka Honey, and read the article. It's really interesting about how this came to be. But the native people in New Zealand have been using it for everything. I mean, and the wood is used for boats and for bark for covering houses. But the Manuka honey has unique properties. It's an acquired taste, but it's very, very good for wound healing. It's antibacterial. And you can take it, if you take it a half teaspoon. It's hard to deal with the honey because it's very, very sticky. But the Manuka honey lozenges are wonderful. But just remember, chewing a piece of sugarless cinnamon gum is fine too. One of the later questions is, why can't I take Manuka honey late in the evening? And the answer is, I'm going to preempt this question. We want you to go to bed with an empty and quiet stomach. Empty and quiet are not the same thing. And if you have something that has calories in it, like sugar, honey, what happens is you get insulin, glucagon, you can turn the stomach back on. So we want people to go to bed with an empty, quiet stomach. And for people who have, get hunger or growling, a bolt of Gaviscon and chamomile tea. Chamomile tea works very, very well. So that's the story. Chamomile tea is the last of the goods. The bads are what I call snake oil, meaning there's not a shred of evidence any of them help. And then the ugly are things that are actually bad. Now, people ask me all the time, there's not a shred of evidence that digestive enzymes have ever helped the soul. Not even anecdotal evidence. No scientific evidence. There's not a paper in the literature. There's not even anything positive on the internet. So if someone's gotten rich with digestive enzymes, I strongly recommend you don't get them. DGL, again, it's like bailing with a bucket as the Titanic is sinking. It's not worth the money. And the same I might add of melatonin, slippery elm, and certainly not peppermint oil. Peppermint oil actually should be in the ugly. Now, you understand that my book called Dropping Acid is the landmark book. Everything in there is science. We didn't make it up. We didn't make up the pepsin. Pepsin is activated at pH 5, really activated in the throat, pH 4 in the esophagus. So you can't have things that are highly acidic. So lemon, lime, citrus, apple cider vinegar. Apple cider vinegar has health benefits, but not for a refluxer. Soft drinks, all of them. We're talking about energy drinks. We're talking about juices, sodas like Coca-Cola, seltzer. None of those are okay. You're drinking a small amount of tea or coffee and water, and that's what I drink. I'm not going to go through the details. So you want to stay away from anything that has HCl or betaine, and all those things are ridiculous because they're acidic. Now, Someone asked me a question that I want to address now. Someone said that eggs and these things turn acidic in your body, right? This is what you call bullshit, all right? If something has a pH 5 and you're eating pH 5, it's pH 5. It doesn't turn pH 1. If something's pH 8, it doesn't turn pH 2 in your stomach. So understand that there's acid in your stomach, there's pepsin in your stomach, that's where it belongs. And so chicken doesn't become acidic. So all of that information is completely bogus. And I'm going to preempt one more question. There's no such thing as low acid. When someone says, oh, you don't have enough acid, okay, that means they're a quack. We've done, I don't know, 15, 20,000 pH studies, and if someone has no acid, which is the first thing we check before we send them out the door, then they may have pernicious anemia, which is a disease, it's an autoimmune disease. It attacks the stomach. They have B12 problems. It's very rare. I've seen 3 cases in 50 years. So there's no such thing as low acid. So finally, I want to make a couple of things. Many of you have told me that your reflux started after you had a cold or whatever and took antibiotics and steroids. And the answer is the combination of antibiotics and steroids is terrible for a routine anything. And so that makes reflux worse, period. Some antibiotics are worse than others. Amoxicillin causes reflux, and Z-Pak and Cipro don't. The problem with Cipro is it turns your tendons into mush. I took Cipro and ruptured an Achilles tendon, and the surgeon said, well, we do 4 or 5 Cipro ruptured Achilles tendon. Someone ought to tell somebody in the NFL, don't let any of people take Cipro or drugs like Cipro. Basically, I'm writing Z-Paks for my people. And if you go to an urgent care, don't go out with antibiotics and steroids. Supplements to avoid: glucosamine and chondroitin. These are the joint medicines, and B-complex vitamins. To my knowledge, there's a whole 2 blogs, one on supplements, good, bad, and the other one on medications, good, bad. For example, ACE inhibitors cause a cough, and most people are on them with high blood pressure and reflux. So, without further ado, made it in 15 minutes talking fast. I want to answer these questions a little more slowly and a little more carefully because I think they're really good questions. So this is a 3-part question. What role does exercising play, sport, and alcohol consumption with respiratory reflux? And by the way, respiratory reflux is the new term for LPR. And the answer is exercise. Let's talk about that. There is a blog on exercise. So if you have reflux, you cannot do downward facing dog. You cannot do planks. You cannot do sit-ups. You cannot do heavy weightlifting. Because anything that increases the intra-abdominal pressure is a bad exercise for you. Walking, an elliptical, and maybe jogging are your best choices. Or you can use light weights as long as you're carrying on a conversation. You're not having to basically do a Valsalva maneuver. I recommend that people take Gaviscon before and chew gum during the exercise. But read which ones are good and which ones are bad. The things that we don't know about. I had a world-class marathoner come to me who had breathing problems the first 30 minutes of running. But after that it got well. He had reflux. And it turns out that with some of these, like running and horseback riding, the reflux only occurs, it seems to settle down after about 30 minutes. But I still recommend the Gaviscon and the chewing of gum. Alcohol consumption. The most important, and all of you need to know this, if you're having a snack before bed, you have reflux that night, every night, 100%. End of story. If you're coming home at 8 and going to bed, eating and going to bed at 10 or 10:30, 100% chance of reflux and silent nocturnal respiratory reflux. So there are basics. So alcohol consumption is number 2. After eating too close to bed or having a snack before bed, alcohol consumption is the second biggest risk factor for a reflux. And I recommend you all do dry January who are drinkers, and I think you'll find that it's one of the factors that makes a real difference. I used to be a drinker and I stopped for multiple reasons, one of which was reflux, but also I found I didn't need the disinhibition that comes with drinking a glass of wine at a cocktail party. and I didn't write as well the next morning when I got up. So, is non-fat yogurt allowed in detox? And the answer is no. And if you go to that last article on alkaline water, you'll see the little bottles, but you also see pH paper. You can take that, stick it in the yogurt, just wipe it off, and sit there and wait. So the answer is you want to be on a diet that's above pH 5, particularly if you're in a detox program. I've written a blog about a detox program, and then the second one, these are all this year, it was about what I call a weight loss program, which is not as severe as the detox diet, but it really will take off weight. For example, if you haven't read Wheat Belly, bread is sugar. Now, I don't know about yogurt. Many years ago, we measured them. We measured about 20 of them, and there were only 2 or 3 that are above pH 5. So the answer is no yogurt on detox diet. I frequently have a piece of sourdough bread for breakfast with either peanut butter or avocado. Are those good options for someone with reflux? This is Cindy. And the answer is beware of peanut butter. I have just done a blog on peanuts at the end of last year. I want you all to use the blog to go in. There are categories. You can type in peanut butter, and up's going to come an article. I think there are 120 articles that I've written. They're all still good. It's not like some other blog where the thing that I wrote last year is out of date. It's not. So understand that there's a lot of material there. Sign up for the blog. All that means is you're going to get an email with the topic each week, and you can delete it if you're uninterested or open it if you are. And also tell your friends about it. Tell your friends about this. It's my job to try to get as much information I can to the public. I'm old. I'm 76, so I'm hoping that I still have a few more years to do some more work. And of course, I'm working on another book. So the answer is peanut butter, maybe not. Peanut butter can be a real trigger food for some people, as are cashews, macadamia nuts, the high-fat nuts. Now, this question really, this is the kind of question that, I cringe. I am so confused. I don't know what to eat anymore. I have issues. I'm allergic to many foods like eggs. I have another book that says seafood and eggs are acidic, and citric foods outside the body are citric, but once consumed, the alkaline effect. So my doctor says to avoid eggs. Okay, now, there is science. We did it. If you go to the bottom of my resume, there's a curriculum vitae. In around 2000, some of the best basic science, cell biology ever done is there. Nikki Johnston did it in my lab, and she's now in Milwaukee at the university. I don't find eggs to be a problem. I don't know why they would be. During the detox, we suggest you don't eat any yolks because they're high fat. And fat is the other thing. By the way, fat makes your lower valve relax as well. So someone who goes out to a steakhouse at 8:30, has a cocktail or two, and then orders a ribeye with baked potato with all the stuff on it and sour cream with béarnaise sauce and a glass of wine or two, has a 100% chance of refluxing all night. So high fat, is not what we want. We want a low acid, low fat diet. Now, I'm telling you that my blog is my most recent book. As this book is coming forth, and it's starting to blossom, respiratory reflux is the title. It's there. And I think, maybe people don't like reading anymore and they all want it on YouTube. So I'm going to start doing some YouTubes. I'll do, some of the really common ones. Like what is respiratory reflux or LPR, what is good about alkaline water, and so on. So the answer to the question is I've written 2 books for you. They're companion books, Dropping Acid and Dr. Goffer's Acid Reflux Diet. And they have everything you need to know to get started and how to proceed in transition and maintenance. This person has GERD for many years, GERD, and has a new development, which is throat irritation and coughing. And all of this is respiratory reflux and excess mucus. So It's not GERD, first of all. GERD is an archaic term used by gastroenterologists for heartburn and esophageal disease. That's not what people have. What you have is respiratory reflux and not GERD. It's irritated by food, cold water, some toothpastes, Listerine. Now, if your reflux is gone, those things may not cause problems. On the other hand, and this question is going to come up again and again, how do I know if this is vagal? So the answer is, there are only three things that I treat in my realm. Burning throat, I mean burning throat. It's all day long. It's not like a heartburn thing. And I mean, it's a big symptom. Painful speaking is a big deal if you're a translator. And a neurogenic cough. Now, if you have anything else, doesn't matter. I had a respiratory infection caused vocal cord paralysis, a vagal neuropathy, and a neurogenic and reflux cough, 30 years ago. And what I'm left with is a vocal cord that's partially paralyzed, but I don't have any of the other stuff. So this stuff has to be treated separately. So the answer is almost none of you have vagal problems, and get off the vagal train, and we'll get there more again in a minute. So the patient who has the irritation with all these different things may or may not have a vagal component. But getting rid of the reflux first is the only way to go. I have a 7-year-old grandchild who has a hoarse voice, had reflux. Parents went to an ENT, said everything looked fine. And the question is, does the child have silent reflux? I don't think dietary elimination is an option at this time. Sorry, I can't help you. I mean, if the kid's going to soccer practice and stopping at McDonald's afterwards to eat, there's nothing you can do. The hoarse voice in a 7-year-old is almost always reflux. And they have nodules or polyps too often. So if you can't change the dietary program, there's nothing I can do to help you. I've written all about reflux, to put the child on medicine, to make the bed more upright. But when I get something like that, I think dietary changes are not an option. Good luck to you. Sorry. Reflux is not a medical problem. Reflux is about diet and lifestyle. There's no treatment that'll make it better. I tell this story over and over and over. I had a patient who had a fundoplication, the best surgery there is by the best surgeon, and consulted me recently with terrible symptoms. Ate at 8 o'clock, went to bed at 10. Had reflux every night. So the answer is diet. She should never eat after 5 for the rest of her life. She's 70, she's my age. Okay? You eat 5. That's it. If you go out to something later, you're not eating or you're refluxing. So, have you treated anyone caused by thyroid nodules pressing on the esophagus or vocal cords? It's possible, but they'd have to be golf ball size. I mean, I've seen thyroid cancers interrupt the vagus nerve and produce airway obstruction and all kinds. But the answer to the question is, can thyroid nodules press on the esophagus and vocal cords? Probably not. The most important question for me so far. Why does my reflux get worse, and this respiratory reflux, when my stomach is empty? I feel better when I eat something before I go to bed. Lee? Sorry, not going to work that way. I tell people sometimes to go on a reverse intermittent fast. So you get up in the morning at 6, you can eat till 4 o'clock in the afternoon, and if you go to bed at 11 or 12, too bad. You're going to go to bed with an empty, quiet stomach. So what you can take are, you could take antacids, but Gaviscon, and for some reason chamomile tea will settle your stomach and help take away the hunger. And Gaviscon and chamomile are what you ought to be snacking on late. Someone asked me a really good question. What about lemon zest? And in my world, all of my lemons are white because I have a real quality microplane zester, and I use it on a lot of stuff, especially fish. And I've never tested the pH. I'm going to be doing a blog on the water drops that people try to keep alkaline, and I've got 5 that I'm going to test. But I got to get new batteries for my pH monitor, machine, and then recalibrate it. So, but the answer is I'll test lemon zest because I don't know. My guess is that it's moderately acidic. Lemon is the most acidic thing in nature, 2.6, 2.7, and the zest is probably 5, but I don't know that for sure. How do we know if we have high or low acid? The answer is nobody has low acid. I've already addressed that. Can tongue surgery cause reflux laryngitis? And the answer is yes, especially if they put you to sleep and they intubated you. So vagal injuries, which can occur with intubation, I assume, put to sleep, a cause of reflux, and so is treating H. pylori, and so are antibiotics and steroids. So are things that can be triggers. They're not the cause, but they're the thing, like the straw that broke the camel's back. So the answer is maybe. So here's another person with symptoms that may be reflux and neurogenic, but yes, reflux, constant throat clearing, excuse me, is reflux, but irritating, dry throat, always doing lozenges, lollipops, and gargling. It gives me temporary relief. So the answer is I don't know, but I would certainly go after reflux first. 3 questions and we'll stop today. First one, kombucha, bad for reflux. The #1 symptom is GI upset and reflux. Kombucha's off. And not only that, they're not all created equal. Someone says, I saw a respiratory specialist who diagnosed me with respiratory reflux and talked about the phrenic and the vagus nerve. Okay, the phrenic nerve doesn't have anything to do with this. All right? The phrenic nerve runs the diaphragm. It's the only part of the respiratory system that's not vagal. So if you have a vagal neuropathy, well, then you'll have vagal neuropathy symptoms. And you should read, I have a 3-part article on the vagus, I have an article on treatment. And then finally, along that line, and I won't answer every question, but I'll get to them next time, I do want to answer this question. Anyway, someone says that they're on gabapentin, and the reflux isn't getting better. Gabapentin is not for reflux, ever. Okay? Gabapentin is for neurogenic problems, and neurogenic problems are few and far between relative to respiratory reflux. So, and furthermore, dose matters, and there's an article on how to treat neurogenic symptoms. So I thank you. This has been a fun-filled and the first of this year. I wish everybody a happy and healthy new year. And my parting shot is reflux is about diet and lifestyle. Doctors don't talk about it, and they have all these crazy treatments and procedures that just don't work. It's about what you do, and I think you can go to McDonald's like once every decade.